Hi, my name's Chris. I'm a physicist working at the Christie Hospital in Manchester, and today I'm going to be talking to you about PET imaging. You might have come across X-ray and CT scanners. These tools allow us to see the structure of the inside of our patients' bodies. You get to see the bones and the organs. You can see here a picture, an X-ray of a patient's arm, and you can see unfortunately that this person has broken this bone. PET scans don't show us where our organs are. They tell us how our processes in our body are working, how our tissues and organs transport and absorb things. This is a bit like the difference between the two pictures here. On the left you can see a picture of the UK from the sky during the daytime, and you can see the structure, you can see the coastline, you can see the mountains and the cities. And then the other picture, you can see the country at night. And this is showing us what's going on, what the people are doing. You can see the lights from the cities and the motorways taking people between them. When we perform a PET scan, we give the patient what we call a radiopharmaceutical. This is a chemical that we've intentionally made radioactive that will be transported around the body in a way that will tell us something about how the patient's body is working. We then measure the radiation that comes out of this molecule to see where the chemical's gone. There are lots of different radiopharmaceuticals that we use in PET, but today I'm going to be talking about FDG. You've hopefully already heard of the simple sugar glucose. Well, FDG will move around the body and be absorbed by the same things that glucose would be. But FDG is special because it has a radioactive atom of the element fluorine, and that's how we're able to make our pictures. How our radioactive sugar travels around the patient's body can tell us a lot about how it's working. We can use it to look at the brains of patients with dementia and look at how different parts of the brain uptake sugar. If some parts take up less than you'd expect, that might be because there's problems with that bit of the brain in that patient. We can also use it to look at the hearts of patients that we suspect might have problems. If part of your heart doesn't take up any sugar, then that means that bit of the heart is either dead or it's not getting any blood and sugar supply, and so it soon will be. And this is important information to help us decide what we need to do to treat and look after our patient. The hospital I work at is a specialist cancer hospital, so today I'm mostly going to be talking about FDG in its use in finding cancer. These little bunches of cells will take up more sugar than the surrounding healthy tissue, and so we look for little bright spots on our pictures. When the patient arrives, the technologist will speak to them about the scan and then prepare their injection. They'll measure the right amount of radioactivity so that we get enough to get good images, but without exposing the patient to more radiation than necessary. The patient is brought to a quiet and comfortable room where the FDG is injected. They'll need to sit still for an hour while the sugar moves around and accumulates where we need it to learn about their illness. Now that the FDG has had time to move around the body, we take the patient through to the scanner to learn where it's gone. The patient will lie on the camera for about 20 minutes whilst we take the pictures, and we'll check these to make sure we've got all the information we need before the patient can go home. Inside this machine is a CT scanner at the front and a PET detector at the back. First we do a CT scan. We use X-rays to create a 3D picture of the structure of the inside of the patient, and then we use the PET scanner to take a picture of the function, the information we get from the FDG, and see where the sugar has gone. Inside the body, the radioactive fluorine atoms will be undergoing decay. The fluorine will be turning into oxygen by creating a particle called a positron. This is the antimatter version of an electron and is a type of beta radiation. These positrons won't travel very far before they will annihilate by combining with an electron. This turns the matter and the antimatter into energy, and this energy will create two gamma rays that fly off in opposite directions. Our PET camera is made of a ring of detectors around the patient, and if these two gamma rays hit the detectors will quickly turn the gamma rays into visible light and then into an electrical signal. It's this electrical signal we use to know if we've measured two gamma rays that the fluorine atom must have been somewhere along the line between them. After we've measured enough of these pairs of gamma rays, the scan is finished. We can use maths to turn these lines into a 3D image of the inside of the patient via a process called reconstruction. We can check these images and make sure that we've got all the information we need, and then the patient can go home. So at the end, we have a CT image showing the structure of the inside of the patient, and a PET image showing where the radiopharmaceutical has gone. You'll remember before I said the X-ray scan is like the photograph of the country during the day. Well, our PET camera has now made the photograph of the country at night. Our FDG has gone to places that are using the most sugar, and they'll be the brightest on our pictures. When the images are ready, they're passed on to a radiologist, a doctor specialising in looking at medical images. They will compare what's seen in the images with what's expected for a healthy person. This helps them work out where the disease is in their body and how active the disease is. We can compare images before and after treatment to see how well the patients responded. In this example, we see bright white patches where there is a lot of FDG, and in this patient that means they have cancer in a lot of their lymph nodes. Fortunately, this can often be treated with chemotherapy, and if we were to do another scan after they'd had treatment, we'd see some if not all of these spots becoming less bright. We can also get measurements of how active a cancer is from these PET images, because the strength of the signal in our PET image is proportional to the amount of sugar that has been taken up by that part of the body. PET scanners are a really useful tool in diagnosing and understanding disease and planning treatment. The information we can collect on structure adds to the information we can collect from other tests like CT and X-ray scans. PET scans are an essential tool in finding out what's causing the problems our patients are having and to plan the right treatments. We need to make sure we take care of the patient, give the right amount of the right radiopharmaceutical, use the scanner properly and reconstruct the images to give the best images to the doctors so that they can decide the right treatments for our patients.